Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Our guest is Dr. Liz Marshall. She's a director of clinical analytics at Linguamatics, and she's here to discuss how NLP, or natural language processing, can improve veteran care and possibly even prevent veteran suicides. Welcome to the program, Liz. How are you?
Good. How are you?
Doing really well and glad that you could take the time. What is your specialty as a physician?
I was actually in mental health research, and I have a large background at the Veterans Administration. Not only do I have a background as a research scientist there, but I'm also a veteran.
Thank you for your service. And as a veteran myself, I do understand the high rate of suicide among veterans, many of which are suffering or often untreated post-traumatic stress disorder, or PTSD. In your experience, what percentage of veterans would you say are suffering from PTSD?
I'd have to say a lot more than that are actually diagnosed.
I'm thinking in some of my experience and some of talking with some other friends of mine, somewhere around 30-40% of we veterans are suffering from PTSD. And that number could be much higher if you break down the population. You say the guys and women who aren't diagnosed.
Correct.
Would you say that PTSD is the leading cause of veteran suicides?
I can honestly say that I don't know for sure, but I would have to say it's pretty high up on the list.
As a research physician, do you practice?
I did not practice. Yeah. What I would do is I did clinical research and with a focus to help other physicians practice better.
Natural language processing, or NLP, what is natural language processing?
So I guess the best way to explain natural language processing is when you look at there's structured data and there's unstructured data. And when you're referring to like an electronic health record, the structured data is when there's areas where you have like click buttons or drop down menus and you can pick something. But with the unstructured data, that's the areas where you're actually typing in information into a field, which of course is what most doctors' notes are made out of.
So these notes, I guess, a language all unto themselves because they're not readily structured.
Yes, and you need to utilize natural language processing to get information out of the unstructured notes.
Now, you mentioned typing into fields, some of this information being unstructured, even though it's being electronically added into fields on a computer. Are we still
Correct.
Dealing with paper notes as well?
Well, most health systems have electronic health records, but there are certain, documents like PDFs that are usually scanned into the electronic health record, and those you scan them in. You have to use the optic software, and then you can get the information out of it. So you can use NLP for that as well.
Now, my question is, what is it about this unstructured data that's not causing it to be included with some of this structured information? How does a file not get scanned, or how does something in a field not be included into the normal EHR?
So it is actually included into the EHR, but it's kind of like trapped within the database.
Okay.
Because you can't get that information out readily. So you can't run a report
mm-hmm.
and get that information out of the electronic health record.
It doesn't lend itself to MySQL?
Yes.
Okay.
I mean, you do. Yeah, it's very difficult to get that information out. So if you think about an EHR, that it was put together for administrators. It wasn't made for clinicians. So there's important elements that are structured, like, what appointments people have, and, if they're going to the laboratory or the next appointment that they have, or the different codes for their diagnoses and things like that. But it doesn't have the information. It holds the information that says kind of what is all about the patient, but it doesn't say anything about why. So if you think about it, a patient might be non-compliant on their medications,
mm-hmm.
but a doctor or, a clinician is going to write information within that patient record and explain why. Why are they not adherent?
Okay.
Can they not make it to the pharmacy? Or they just don't feel like taking their medication. Maybe they forget.
So the physician annotates that, And then somewhere down the line, an analyst like yourself or someone else is going to need that information to make a much more informed decision about how to encourage this patient to be more compliant or compliant at all?
Correct. You can't actually, change the behaviors and make patients better unless you know, why they are doing what they do.
Is any of this information withheld deliberately for any reason at all, or is it just simply lying there, having fallen through the cracks, and no one knows that it's there until they're actually looking for it and have to go on this quest?
The second. I mean, we practice medicine to make patients better. It's not a malicious thing. The problem is when you only have 20 minutes with a patient and you're sitting in front of a workstation, the last thing you want to do, you want to type and get all that information in. You want to have some eye contact. It might be nice. You might actually have to do a physical of some sort. And to actually be, trying to find certain pages within that patient's record to find the correct button to click, you're just not going to take that much time to do that.
Now, I understand that you're a mental health researcher. And I also understand that NLP wasn't developed or invented for the healthcare industry. In your experience, when you're talking about some of this life-saving information that can be gleaned through NLP, is it more crucial, would you say, for the mental health aspect of the veteran or for the injury aspect, or do they go hand in hand?
All the above. So if you think about the VA, so we have the VISTA system. So you're looking in the patient's records and they're marked as being having a suicide attempt. So you know from a structured report that they have that suicide attempt in their past. But there's not any kind of information saying, within the structured information saying if they're actually at risk again or perhaps, they're well controlled. It's going to say if they're, the clinician is going to report if they're feeling hopeful or perhaps they're feeling, they had just lost a loved one and are about to almost take another attempt.
Do you think that the VA is going to spearhead much more widespread implementation of this technology?
Yes. I mean, I'm not working there anymore, but I do believe that I've talked to quite a few people and there seems to be some efforts into putting it into part of the workforce.
When NLP is doing its thing, can it determine what is pertinent based on who's making the inquiry or what department or entity? Or does it just say, you asked for it, here it is, regardless of the nature or sensitivity of the information?
It's going to have the same HIPAA guidelines when you're utilizing NLP as if you weren't utilizing it, any kind of reporting. So it's very sensitive information regardless.
So it's very HIPAA compliant as most of the things.
Oh, yes.
Where can we learn more about NLP online?
Well, you can go to my company's website at Linguamatics.com. And of course, we have some information. But NLP and of course, there's always Google. But NLP is one of those areas where it's so specialized that it's not one of those things where you can usually take an easy course.
Mm-hmm. So it's something that has to be seriously considered and researched, I guess, to get a handle on it sounds very complex.
It is. It depends on what kind of software that you utilize. So the open source software, most of it is people have to almost be a PhD data analyst because it's coding. And then there's my platform that I actually utilized during my fellowship training. So it was more important for you to understand the data itself than to know how to actually do the coding and things like that.
Well, Dr. Marshall, I thank you for coming in and talking with us today.
Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Elizabeth Marshall, Director of Clinical Analytics at Linguamatics. Learn more at www.linguamatics.com. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes. Be sure and follow us on Twitter and Facebook, and visit our affiliates page when you visit us at hpr.fm and healthprofessionalradio.com.au.